Good morning. Welcome to our March contract entity meeting. My name is Joy Weems, and I am the Provider Services Manager for PHLpreK and will be your facilitator for today's meeting. So our welcome question comes from the statement, April showers bring May flowers. So this is the concept that sometimes unfavorable things yield favorable outcomes. So in thinking about this, what are some challenges in your program that result in positive outcomes for children? The first thing I think about sometimes is teaching strategies gold, where, it takes a lot of time to complete the documentation, upload the documentation, complete the assessment. But we know on the other side of that, right, we get to see if children are learning, what skills they're acquiring, and how we can guide instruction, right, to have positive outcomes for young children. So, are there any other challenges you can think of in your program that may be a little difficult to do or difficult in the beginning, but they do result in positive outcomes for young children? And you can put them in the chat. Okay, so far I see getting early intervention services for students. Yes, that is absolutely a challenge sometimes. Just the entire process from the time that we start referral, submit the referral to the time of getting an IEP meeting and then getting the services actually deployed. So there's a lot that goes into that. But of course, on the other end of it is that children receive the supports that they need. So thanks, Amy. We have from, let's see. Behavior challenges, yes, those are definitely challenges. But again, if we can deploy the right supports, then we can, support children. Ebony has consistent early intervention from meaningful instructors. Yes, same, along the same landscape there that, it's challenging. It is definitely challenging to get the early intervention supports. And parent engagement. All right, thanks, Christina. So yes, sometimes it is difficult to engage families, but we know that once families are engaged, right, you can partner with them so that the child is getting consistent messages from the family and the center. And again, the best outcome for the child. Aaliyah has individualized lessons on your lesson plan. Yes, thanks. That takes a lot of time, right? To do individualized lessons, but we should individualize for children. So again, we're meeting their needs. Training new staff to do meaningful lesson plans. So yes, absolutely. Because if we have, teachers are able to develop good lesson plans, hopefully that means they are implementing, great lessons that children are really learning from. Uh, Angela has getting parents to agree to referrals. Yes, I know that to be true. So, but again, we know on the other side of that is that we can get children evaluated and hopefully get them the supports they need. So I think we have parent, we have more services, more responses about services, speech and behavior services. Staff retention, absolutely, Saida. That's a challenge. Some of us just came from a meeting where we were talking about, the challenges that we have in our system with staff retention. So absolutely. Getting updated IEPs. Well, thank you for that. Yes. And I just want to put a plug there that if you are having challenges getting updated IEPs, you could reach out for family navigation support. Can't say we get them 100% of the time, but our success rate is pretty high for getting programs IEPs when you don't have a copy of one. Maintaining the quality of PHL with the state and stars, or I guess that's saying maintain the quality of PHL, the state and stars. But the results are great. Yep, absolutely, Alice. Thank you. Hey, I think we're wrapping up curriculum, content fidelity. Absolutely. Getting Elwin to come out and do services. Yes, yes. Yep. There's a theme here. There's definitely a theme here. So we know that it is very challenging to get the early intervention supports, but we're going to keep plugging away at it. Okay, well, thank you. Thank you so much for sharing those responses. Thank you. All right, our agenda for today includes a presentation from Children First. Then we will have a presentation from the Philadelphia Department of Public Health, followed by contract updates, enrollment updates. We'll talk about the Q4 compliance monitoring and the deliverables that will be monitored during Q4. There will be a feature today on our Family Corner, and then we will wrap up our program with a presentation from our Quality Support Center, and then we'll also talk about some upcoming engagement activities that are being facilitated by the Office of Children and Families. All right, so we have our Children's First presentation. Let's see. Is Donna on? Donna, are you there? I'm trying to look down the list to see if you're on. Okay, well, I don't see Donna yet, as I look who's on the call. So we will move on to the presentation from PDPH, and then I'll check in to see if Donna is on after that presentation. So. Mia, are you
Hi,
there?
I'm here.
Hi, you're on. Okay. All right. So I'm going to come out of this presentation and go into your presentation. So can everyone see this screen? It says stay safe from measles.
Not yet.
Not yet.
Not yet. All right. So then I will stop sharing and share again.
My colleague here is with me, Tanya Dengra. She
Okay.
is the manager, the program manager for our pediatric partnerships program. And I'm
Great.
sure she's worked closely with your providers in this community as well as on this platform as well. Say hi,
Okay.
Tanya. Oh, there we go.
Good morning, educators, providers. Thanks, Mia. Yeah, I think I recognize some of the names. I definitely recognize names of some of the childcare sites. And excited to share this information. I will monitor the chat for your questions and put some resources in there. And wonderful, Mia is going to just take it away.
Thanks so much, Tanya. Appreciate you being here. And thank you all, teachers. I appreciate you taking care of my son when he was that age and getting him his early intervention and things like that. So he's in sixth grade now and he's doing wonderfully. But I do so much appreciate, I'm from Philadelphia. I no longer live in Philly, but I do appreciate him getting his start there with the Head Start programs there. And thank you. You guys saw a lot in him, and he would just blossom at school with his peers. And I would say, he's so shy and quiet. They say, no, he isn't. I'm okay. So, but I thank you. Thank you. So let's get our presentation started. My name is Mia Renwick. I am a nurse here with the health department. Today we're going to just go over some points about measles. As you know, measles vaccine is required for daycare as well as school. So we're just going to go over how to stay safe from measles, some information about early childhood centers. Next slide, please. So what is measles? Measles is a highly contagious virus that's especially dangerous for babies and young children. This virus is more contagious than any virus that we know. And that what makes it a major concern when we talk about child care centers. In fact, if there were 10 unprotected people in a room and there was one person in there with infected with measles, 9 out of them would get sick with measles. That's how contagious it is. Next slide. So how does measles spread? We know that it spreads through the air, just like with any respiratory virus, but this isn't a respiratory virus. It spreads through coughing, sneezing, or even just breathing near an infected person. It can spread before the rash appears and after the symptoms have ended. The germs stay in the room up to 2 hours after the infected person leaves. All right. Next slide. So, like I said, measles, it is the most contagious virus we know. According to the Academy of Pediatrics, they call it the most contagious virus known to man. So each person with measles can infect a dozen or more other people. All right. A person is contagious 4 days before and 4 days after the measles rash starts. Like I said before, 9 out of 10 people who are not protected against measles, they come in contact with someone with the virus, they will get sick. Next slide. So how can we recognize measles? How can we figure out, is this measles, right? So talk about the symptoms. The symptoms, you get a high fever. Now that fever can go well above 104 degrees. A cough, runny nose, red and watery eye, like a pink eye. And this is before the rash even starts. So 2 to 3 days after those symptoms, a person or the person, I won't just, because this is not just for children, this is for people, whoever's susceptible. All right. So you look inside a person's mouth, you see these white spots. They're called Koplik spots. So 3 to 5 days after all of these symptoms start, you'll see a rash. So a rash that starts is like flat spots on the face. They'll start on the face and spread downward to the neck, the trunk, arms, legs, and feet. All right. Symptoms usually start 1 to 2 days prior or after the rash starts. Management of measles. So how they manage measles in the hospital by your healthcare provider. There's no cure for measles. Let me say that straight out. There's no cure. Treatment is normally supportive, and it can include medications for fever, fluids for a person. You guys, you ever been to the hospital? You see someone hooked up to an IV, or they're getting intravenous or fluid or food through their IV for people who can't eat or drink enough. Oxygen to help for people who may have trouble breathing. One other management is the use of vitamin A. So vitamin A is recommended only as a part of a supportive treatment for children with measles. We normally see this in kids who are deficient of vitamin A and supported mainly in the hospital or outpatient, only through a doctor's supervision. All right. So vitamin A treatment, it must be administered under the supervision of a healthcare provider, not just at home. Okay. You can't go to the store and be like, hey, give me some vitamin A. My child has measles, I think. So that's not something that we do. Vitamin A does not cure measles. Okay. It has been shown to reduce the risk of complications. And there is no specific antiviral treatments to cure measles. The only way to prevent measles is to get the MMR vaccine. All right. Again, vitamin A does not prevent measles, and it can actually lead to toxicity. Why? Because vitamin A is a fat-soluble vitamin, meaning it likes to hang around. It doesn't clear your system. And I don't mean to be graphic, but I'm a nurse. It's not excreted through the kidneys, like you can't urinate it out. I would tell people, you can't pee this out. It's going to hang around in your fat and in your body, which could lead to toxicity. So by all means, if you're having these questions about any other medication or supportive medications, tell your parents and your colleagues and your partners. They need to talk to their healthcare providers about their questions and concerns. Again, only the MMR vaccine can prevent measles infection. Next slide. So like I said, the only way to protect you and yourself and your children is vaccination. So the MMR vaccines, that's the mumps, measles, and rubella vaccine, or the MMRV, which is the mumps, measles, rubella, and varicella, which is chickenpox vaccine. It's a 2-dose series for children. I won't just say for children, it's for adults too, if you are not vaccinated or you don't have protection. Like I said, 1 to 2 doses for adults. The effectiveness of this vaccine, that's the thing here. 93% effective with 1 dose of vaccine. 2 doses, you get 97% effectiveness. All right. That vaccine offers lifelong protection. Next slide. Oh, go back one slide. Let me just, sorry. I just want to hit this, when do we get it? So you get the first dose normally 12 to 15 months. Second dose is usually on the schedule between 4 to 6 years. And there's some nuances to this. I'll talk about that in a second. Next slide. So how can we prevent the spread of measles in daycares? We can prevent the spread by strengthening I guess, just being mindful or keeping an eye on things such as vaccine records. Make sure your vaccine records are up to date for not just only the children, but also the staff. All right. This is a form that I know every time I take my kid to school every year, I have to fill out this child health report. Not only, well, a healthcare provider fills it out. So not only does it get like your demographic information, it also gives about your medical history, like if the child has asthma and things like that. But it also has the big section down the bottom for immunizations. Normally, this is accompanied with the actual shot records, a list of them. They usually staple them together. So request this from your participants. And make sure that you have it up to date. Each year, they should be updating their vaccines, whether it's for childhood immunizations such as measles or for flu and things like that. All of that is captured on this child health report. Other thing you can do, because measles is so contagious, outbreaks happen very fast. So if you suspect measles, or if you get a report that, oh, the child is out with measles, we need for you to immediately notify us. The number is here on the screen of any suspected case, any exposures, things like that. Any child with a fever and or a rash should be sent home immediately and excluded from daycare. And parents too should be calling you and calling your doctors about these symptoms. So if they say, oh, my kid has a high fever and a rash, they should be notifying their doctor as well. All right. So work with the health authorities to prevent further spread. And just to say, most of the time, children who get measles are the ones who are not, or who are either not up to date or maybe too young to get the vaccine. Next slide. So what to do for those that are exposed and unvaccinated? So if you have children in your daycare center or in your ECE who may be unvaccinated for whatever reason, they may have an exemption, right? We get into that a lot, an exemption. It may be religious, it may be health related. So one thing you can do is ensure that the children who are behind on their vaccinations, make sure that they receive their MMR vaccine as soon as possible. Vaccines are available at the city health centers. There's no appointment necessary in order to get these childhood vaccines, especially MMR. You can walk right in, or there's the numbers there for you to call if you want to schedule an appointment, but no appointment is necessary. Any child in Philly can get vaccinated at any city health clinic, okay? They're available for, like I said, walk-in or appointment. No ID or no fee is required, all right? Unvaccinated children will need to exclude from school for at least 3 weeks when they are exposed. However, an unvaccinated child that receives 1 dose of the MMR vaccine within 72 hours, which is approximately 3 days of the exposure, no longer have to be excluded. So case in point, if you have a child who may be unvaccinated, maybe they missed their doses, we went through a pandemic where people, we couldn't get into the doctor's office, but now we're catching everyone up. So if you come across it, if this is happening in your facility, there may be a child or some children who, oh, they didn't get their vaccine, they're behind, they don't have any exemptions or anything like that. If they get the vaccine within 3 days or 72 hours, they do not have to stay off of that 3 full weeks. Okay, so they can come back. Next slide. So what about travel? When you're traveling in and out of the United States, the CDC recommends that prior to international travel, if you're traveling with your family and you have an infant that's 6 months or older, they can receive an early dose of MMR vaccine. All right. We want them to receive that dose at least 2 weeks before departure. All right. Don't be like me scheduling your flights a month ahead, right? So plan. So, if you're going on summer, if you're going on vacations, and you're taking your young child, especially internationally, if they're 6 months and older, they can get 1 dose early. And once they turn 12 months, you continue with their regular schedule. Like they'll get another dose at 12 months, between 12 and 15 months, and then they'll get a final dose between 4 and 6 years. All right. So that's not that first dose. I don't want people to think that first dose is taking the place of their regular schedule. That's just an early dose to give them the added protection. All right. Children aged 12 months and older, they should receive their second dose prior to travel. As long as it's 28 days after that first dose, they can get the second dose. Currently, an early dose for MMR for domestic U.S. travel is only recommended for if they're traveling to places where there are known outbreaks of measles. Please note, I just wanted to make a note of this, that the early MMR 1 and 2 doses for non-travelers are not recommended unless there's evidence of a sustained or widespread community transmission. All right, so those early doses are recommended as a preventive treatment for people who have been exposed to active measles in certain situations. But the Philadelphia Department of Health will offer guidance in those situations. Next slide. So where can I get vaccinated? So here is a list of our city health centers. I also have a link to some other resources on the next slide. As you can see, they're strategically placed across the city. Next slide. And these links are active. So these are just some resources. We have links to our measles flyers. I also included some H5N1 information, that's bird flu. Just to put the plug in, if anyone's planning on having a petting zoo at your facility, please don't. All right, we don't want kids touching wild birds and animals because of the potential of them contracting H5N1. So don't do that, not this day and age. So there's information about vaccines and autism. I put links in there. Just some information for you guys to have if you're having questions from your parents or even staff if they have questions about that. Next slide. Are there any questions? I see that there are some questions in the chat. So the next couple slides are just some flyers that I posted. If you want, Joy, you can just kind of skim through those real quick. It's about, I think it's 3 or 4. Yep. So this is just some flyers that you can for sure print out. So flyers about just basics about get the facts about measles. There's a flyer about traveling, how to be safe when you're traveling with your family. And you can please feel free to print these out and post them in your facility. Also the links. I can put the links in the chat as well. So I'm here for questions, Tanya, now. If you have any questions, let me go to the chat.
Thanks, Mia. I just also would like to plug to everybody that the health department continues to provide no cost PPE, hand sanitizers, and COVID-19 test kits. And some of these resources that are printed and available will also be provided. So I'll put the link for that form in the chat as well. And then I did mention that Mia will share the PowerPoint with Joy to disseminate right after the presentation. So you will have access to all of the right links. Additionally, you also have the ability to call our call center during normal business hours, and they're able to provide information and connect you with a clinician, much like Mia, with any questions you may have, any resources you may want to get connected to. They're a great resource as well. So I'll just add those 2 things into the chat as well.
Thank you, Mia and Tanya. And it looks like, May, you have a question?
Yes, hi, Tanya. Here's a challenge. Generally, out of my 18 years, which is nothing compared to a lot of my colleagues in this field, um, recently I have like one or two families that does not have vaccination. I guess they're opt out for those vaccine. And I don't know, because like I said, I have never doubted them with this, and I've worked closely with the policy, best practice policy of how to do this. But it's very exhausting to work with these family. I don't know how to handle them. Basically, that's my challenge. I think that's one thing that keep me awake at night. How when these parents come to me when they're not found the standard, like especially in sickness, in certain season, kids do get sick and they opt out of being vaccinated. How do I handle those? I mean, I think that's my challenge there.
And that could be, and I'm sure that that's a challenge for many. Um, the one thing I would say is one question I would have to I wanted to ask, like, so are they opting out of all vaccines or are they just picking specific vaccines? Is this a family that say no, we're not taking any,
Well,
so no
there's
childhood vaccines, no nothing, no any at all.
so there's two. There's one that opt out completely, and
Uh-huh.
there's one I've seen their health record. It seems like they have gotten their vaccine when the kids were younger, but then up to a certain time they just stop.
Okay. All right. So, I mean, I would have to just kind of defer you to whatever your policies are. I know that was to my understanding that in order for a child to be in child care or school, that there are mandatory vaccines. However, some families choose to opt out for what they call either religious exemptions or medical exemptions, but they have some type of exemption. So again, I'm not the one that's going to have to police them. So I'm going to have to defer you to whatever your policies and your governing bodies, um, or, whatever their rules are that you have to follow. But I would say in case of a situation like an outbreak of measles or cases of any infectious disease, where they are susceptible of getting sick or very sick, they will have to be excluded. They should be excluded.
So, like you said, just deferred back to our policy of
Right.
what we're
So
using, and
right. As
it's
far as like keeping them day to day, like, so in one thought pattern, it would be okay, this child has an exemption for vaccines, but everyone else around them is vaccinated. So they're protected, so to speak, right? They
Mhm,
get
mhm.
that what we call herd immunity a little bit there in the room in school. But we know that all vaccines are not 100%, right? You get
Mhm.
some, you could have some kind of slip through or whatever. If there is any cases of any infectious diseases, such as chickenpox, measles, other things that where you say, okay, I need to go through and make sure everyone is immune because those who are not immune can stand to get very sick or may even die. So you
Here's
don't
the
want that. So you have to exclude them if that's the case, if there
yeah.
was, in those
Yeah,
situations.
my understanding about some of these sickness is that the kids that got vaccinated, they're covered because they're covering themselves. However, those vaccinated kids could also be a carrier. So that was my scary part is that those vaccinated kids can be also be a carrier and impact those that are not vaccinated.
So the thing about vaccination and immunity, so we get vaccinated so our body can elicit that immune response, which when I so like I'm not going to say that okay, so let me just use me as an example. I'm immune to chickenpox, right? Um, I used to work in that area where I dealt with outbreaks with the schools and daycares and all that for many years. Since I'm immune, I have immunity. I have test results that say that I have immunoglobulins, right? I have these antibodies. Every time I go into a situation where there's an active chickenpox case, I get a boost in my immunity, but I don't spread it to no one else. I'm not a carrier. All right. So I'm not carrying it where it can be transmitted from me to tying it to whoever else is sitting around you. it doesn't go like that. I know in our minds we may think that we're carrying it, but we're not transmitting it. Our immune system is handling it. All right. And is rendering it inoperable. Like it can't be transmitted. Okay. Only active disease can be transmitted, if I'm making sense. Does that make sense?
Yes, thank you so
Okay.
much.
All right. So also the kids who are vaccinated, they're not, they're not, they don't have active disease. So they're not shedding what we say virus. When we talk about measles, how it spread through your breathing, you're talking, you're shedding that virus. All right. You have an active rash, someone can touch it, get in contact with it, they can get that. So they don't have that. That's not happening for them. All right. Because they've been vaccinated, they're protected, they're not going to develop the disease. Okay. I hope that makes sense.
Thank you.
You're welcome.
Thank you. I thought I saw Amy with a hand up. Amy, I don't know if you still want to ask your question, but we can see if there's other questions in the chat as well.
I just had it was kind of similar to what we were just listening to. I have a few families, more so now than I have in the past, that are not vaccinating their children. Um, when we're told if a child who is unvaccinated comes in contact with somebody who has um measles, they're to stay, that child that's unvaccinated is to stay home for 3 weeks. But what do we do if we have a parent who is insisting that they don't want to keep their kid home and brings their kid to school every morning? Like, how are we to,
No, you're the gatekeeper. So this is the thing about
yeah.
measles. You're the, I mean, in essence, you are the gatekeeper. So we are ourselves can't come down and be the police in front. So that's just like if my child was severely sick, maybe with norovirus, and I know they're throwing up and I gotta go to work. So my frustration is I need to get this kid off of me so I can go to work and make, continue, to keep my household running, right? But the bottom line is, okay, the kid cannot be here. They could stand a chance of getting everyone else sick or some other people sick, or getting more sick themselves. All right. So I would say you guys are the gatekeepers. So if the child has an exemption, that's fine. They're okay to be in school as long as there's no exposures and things going on or cases of measles in the school. You should be sending them right back out the door, you know.
No, I agree
Lack
with
of
you
lack
a
of better
hundred.
terms. I'm sorry. I don't mean to be insensitive, but when it comes to something such as measles that's so infectious,
Hmm.
it's so contagious.
And I
Um,
agree with
for
everything you're
sure.
saying. And it's hard
Yeah.
to, sometimes I find it hard to get our parents to understand certain things, like just keeping your child home because they're sick, and we can make sure that you get work to do, whatever the cases may be. But um, I just find it, I'm just, in the past, it had nothing to do with like health, but I had a child who we couldn't, we didn't want the child at school until we had a plan in place for what was going on. But every day the caregiver brought the child to school every morning. And it's like, I feel like we get to a point where we no longer have a say,
Yeah,
because
you have a say.
I know we do, but if the parent's going to continue to keep bringing the kid in and drop them off and walk out the door, because we've had that in the past, um, that's my only
Right.
concern, is if I have a child who is unvaccinated and there is a case, how do I convince that parent to keep their child home? That's, and I know it's on us, but I'm just, it
Yeah.
happens out here. It's
Yeah.
crazy.
And I understand because I again my son was in pre-K and daycare, since he was 4 months, right? I'm sorry, 6 months. I took him after when he could first get his first round of vaccination. So he'd been in there since then, but he's in elementary school now, middle school. So my son got sick from parents who would just bring their kids to school sick. And it's frustrating, because like you say, they'll drop them and they'll keep going, here and keep going. They're not a helicopter parent like I was. I would hang around a little bit. So you could redirect me, say, oh, no, Mia, he has a fever or he is runny nose. What's going on? And I'll be like, okay, I'll fix it. But again, like you guys have to be the gatekeeper.
Hmm.
It can be frustrating. And just appeal to the parent. Like I understand, like you want your child here, but we want your child to stay healthy. We don't want
Hmm.
your child to have these complications that can come with these infectious diseases. All right. The other option is to get them a dose of vaccine, you know,
Mm-hmm.
to get them a dose. They can walk in, they don't need an appointment. How about walk into the clinic, getting dosed, and then bring them? You know what I mean?
I,
Like
I,
you can appeal to that. Like to kind of appeal to
mhm.
we want your kid to stay healthy,
And I
And
think that's important. I feel like if parents had more resources and they had an opportunity to have a sit on a meeting like this and have someone explain to them how important it is for their child to have it, um, we may have more children vaccinated. I used to work in peds before I came to education, and we had parents, especially in Center City, Philadelphia, that didn't want to vaccinate their kids. And my doctor was like, okay, that's fine. Like, he never tried to explain why it's important to have their children vaccinated. I feel like there's more cases of non-vaccinating children. Doctors are a little more to, okay, if that's your religious belief, then we can give you that exception paper.
right. And I understand that piece as well, just working just as a nurse working in healthcare. But the one thing I like to educate my patients when I'm out in the acute facilities, I like to let them know what that comes with. Your kid is going to start school and this could happen. They could be excluded from school, if there's, a situation that warrant that, such as cases or outbreaks and things like that. So it's just kind of making them, educating them. Okay, this is what's to come. So it won't be like, oh no, I'm dropping them off anyway, So this is again appealing to the healthiness of the child. Like we want to make sure all the kids are healthy and safe. So yeah.
Thanks.
Burke has his hand up.
Correct. Yeah. And now I would just say that after Brooke's question, we'll just move on because we do
Right.
have a few more presentations.
Yeah.
But I did see that Tanya put her email address in the chat. So if there are additional questions after today's meeting, please feel free to email Tanya. Okay. Thanks, Mia. Burke?
Thank you.
Mhm.
Yes. I just wanted to see if we could speak for providers on, because the PHL pre-K contract is pretty explicit about suspension expulsion policies. So when this scenario does arise, what would a provider have to do to be able to have that child essentially be suspended for those 3 weeks while still remaining in compliance with their contract?
Burke, is that question for us, PHL pre-K?
Yes.
Or, okay, all right.
Yes.
Well, one thing I will say is that PHO Pre-K follows the guidelines of DHS, right? So,
Mhm.
we always tell a program that they have to be in compliance with DHS. So whatever guidelines they need to follow to be in compliance with DHS would be the guidelines for PHO Pre-K. Does that help?
Yeah, it just
Okay.
I think, is it even something as simple as just that documentation to PHL pre-K? Just in that, the contract is pretty explicit that they cannot unilaterally suspend or expel a child. And I just don't want any provider to feel uncertain about what they're allowed to do in this case if they're looking at that contract and then also not sure what steps to take for that as well.
Mm-hmm. Yeah, and I don't know if Kerry wants to add anything, but I believe the intention in the contract around that language is not for this situation, right? Because again, it may be somewhere in the contract where we cover that programs have to abide by DHS guidelines. So when we do have that part of the contract that talks about suspension and expulsion, I don't believe this particular content is part of that. But Carrie, is there anything you wanted to add, or did I misrepresent anything?
No, I think if folks have questions, they should be reaching out to their specialist. I think the
Yeah.
suspension and expulsion policy is that that providers should not be independently suspending or expelling a child. Um, so please reach out to your specialist.
No, Joe, that sounds great. I just wanted that to be sort of explicitly stated for all the providers here.
Yeah, yeah. No, absolutely. That was a good question. So yeah. And I think to Carrie's point, and often the specialists do see this. So anytime these type of situations are coming up, more than likely the provider is talking to their specialist and then they're bringing it to leadership and then we are, supporting that provider together. But I just definitely want to underscore that providers have to meet DHS regulations, but should be in communication with us. So if it does get to the point that a child, may need to be suspended because DHS has said this child can no longer be in the program, then the provider should be communicating that to their specialists. Right. All right. Well, I want to say thank you to Mia and Tanya. This was a great presentation, and it definitely fostered a lot of questions. So I'm so grateful that you guys were able to come and present to us today. Thank you.
You're welcome, and thanks for having us. I'm trying to get
Yes.
these links in the chat before I drop off, okay? But if
Okay.
there's any other questions, Joy, please feel free to collect them and send them to us. You have my email address and Tanya's email address is in the chat. All
Right.
right.
Okay.
Thank you so much. I have a great day. Thank
All
you,
right.
teachers.
Thank you.
All right. Bye-bye.
All right. So I'm going to stop sharing because I have to get back to the other presentation. And I was looking, I still don't see anyone from Children's First. So I'm assuming that they're not here. But let's see. Here. Is there a representative from Children's First on the call? Okay, guess not. All righty. Well, we will move on. Let's see. All right, we are at the point where we are going to have some contract updates, so I will turn it over to Carrie.
Hi, all. I'm Carrie Lee. Just some quick updates on the contracts front. So on this slide, you'll see information about FY26 seat selection. So I know some of providers have made seat increase requests. That was way back in the FY26 continuation form that you completed last November. Those seat requests are still under review. Notifications are expected by spring 2025. For the public pre-K teacher incentives, the second cycle submission forms, the deadline has passed for the majority of folks. They're being reviewed right now. Payments are expected by May 30th, and there is no expectation that you are paying folks before you receive notification and payment. We'll send similar notifications out that we did for the first round about eligible teachers. And if teachers do leave prior to or after you receive payment, please email PHLpreK@phmc.org.
Okay, well, so that was short and sweet. Thanks, Carrie. So I will turn the presentation over to Jennifer Harris for enrollment updates.
All right. Good morning. And yes, enrollment updates. I'm Jennifer Harris, Enrollment and Family Engagement Manager here with PHLpreK. So, first starting off, friends, don't let friends miss open enrollment. So, first, we want to share about future discharge. You want to make sure that you're discharging all currently enrolled children for the FY25 school year by May 30th, 2025. And you'll put that future discharge date. So what does the future discharge date mean? The date should be the last day of programming that you have documented in your program calendar. If you enroll a child after you've entered all of your future discharge dates, all you need to do is enroll that new child and then enter that future discharge date for that child as well. If a child leaves before the future date that you've entered, please just submit a ticket to the help desk and we'll work to get that cleaned up for you. And lastly, if you enter, you don't have to enter it individually. We do have a bulk discharge feature that you can use to discharge all children in the individual classrooms at one time with that future discharge date. Listed below, I have listed some tip sheets that you can use to support you in doing the bulk discharge. Again, if you ever have any questions, don't hesitate to email us at phlprek@phmc.org. So, going back to the open enrollment began on January 21st. Um, so our timeline for enrollment, we've done some office hours to share about the open enrollment as it is earlier than it has ever been in PHL pre-K history. So we did offer some office hours and some enrollment trainings. We will be offering another training of support in May and June as we're preparing for the closing of FY25. I'm sorry, FY25 going into FY26, something like that. You get mixed up in those. But we will be offering some more support just to make sure everybody feels comfortable as we are transitioning to the new fiscal year. With that being said, providers should be enrolling all returning children. You want to re-enroll all of your returning children first, then children aging into the program, and then all new children to your program. We are hoping that, again, all children that are currently enrolled for the FY25 school year have a discharge date by May 30th. And then providers want to work towards demonstrating 50% enrollment in childcare by August 29th, with 100% enrollment by September 30th, and then October 1st, working towards to having that growing wait list. So we have started a unified online application, moving towards that unified process. Now is the time again to begin re-enrolling for your returning children. Again, returning children, children aging in, and then new children to the center. I wanted to also highlight, I talked to a provider and they weren't able to see their children that had applied for the new year. When you go into your account, you'll in the top left corner, it's the enrollment and it say 2024, 2025. That's for the current school year. But when you do the drop down for 2025, 2026, you'll be able to see all the families that are interested in enrolling for the fall. Some children may have applied for the fall and may qualify for now. You for sure can reach out to that family and say, hey, we have a seat. Would you like to be enrolled to support that family? Or they can start in the fall coming up. But again, I wanted to let you know there is a toggle. So you want to make sure you're looking at either the 24-25 for the current school year to continue enrolling those families that have submitted applications, but also looking at those that have submitted applications for the upcoming school year. Yes. So, there are some updates to the enrollment process for 2025-2026, including administrative access, tagging in the Free Philly Pre-K portal, and how to enroll returning children. We do encourage that you review the enrollment guide, which we have put in below the links. We have a digital version as well as a PDF version. Administrative access. You now have access to tag children, and we strongly recommend that you tag children. And I'll talk about that in the next slide. But the different tags will let us know that one, you have acknowledged that application, you are working with that family, and lets us know once they have been put into a seat. We know that some programs offer PHLpreK, some programs also offer Head Start and or pre-K counts. So you can tag to say this child was enrolled in whichever seat it was, because if somebody applies online, if they're more appropriate for your pre-K count seat or your Head Start seat, please enroll them in that seat and just tag it so that we don't remove that child from your listing. If they're enrolled in a PHL pre-K seat, please tag it so that we know that, again, their child has been put in a seat. The tagging, again, we're going to the next one and how to enroll returning children. So let's go to the next slide. So tags, as shared, you will tag the family as enrolled at PHL Pre-K if that child was enrolled in a PHL Pre-K funded seat, as enrolled at Pre-K counts if they were enrolled in a Pre-K counts funded seat, and then enrolled at Head Start if they were enrolled in a Head Start funded seat. There's also a couple of other tags that you may use. One is application withdrawn. That means that the family is no longer interested in your location. Processing, where you're trying to figure out which seat is appropriate if you do offer more than one funding stream, but also trying to get other documents before you can officially enroll the child at your program. The next one is site full. If your site is full for all pre-K seats, we ask that you please tag them as site full so that we can move the family to their second choice. And then lastly, no longer interested. You contacted the family and they expressed that they were no longer interested in your location. I do want to shine out some centers. The centers listed here have been using the tagging system, and it's been helping us to make sure that we are swiftly moving children to their next seats. Amazing Kids Academy Cheltenham and Kids Palmetto and May, Bright Star Learning Academy, Children's Village, Druden Center, Early Childhood Environments, Goulds Learning Academy, Grace Ferry Learning Academy, Early Learning Academy, excuse me, Irene A. Oakley, Jubilee, Land of Learning, Mary Munchkin's Land, Olympic Tots, Precious Playhouse, the Children's Community School, the Magic Deers, Tots. We do appreciate you as you have been using that process of helping us to know that you, one, have made contact with the family, supporting that family, and have enrolled that family in one of the seats. So, what's new with this new process? Glad you asked. Number one, providers can only view applications marked as their first choice and should process all applications with the status of submitted for the FY26 applications. So, our current school year, the FY25, the 24-25 tab in Abella, Free Philly Online, those children, we're following the same process. We want to make sure that it does say ready for provider review for you to process the application. However, for FY26, when you select 2025-2026, you will only see families that have selected your location as their first choice. And we do strongly encourage that you do reach out to them based on the order of how the application has come in, so work to get the other documents to get them enrolled. And once you have gone through your list and enrolled all that you can and you're at your capacity, again, just tag them as site full. The second one, again, providers can now update a child's tag in the Free Philly portal. Again, you're encouraged to make outreach to the families within 72 hours and to update the tag as appropriate. I do hear often it will be lovely if the system could let you know when a child is added to your listing in the system. We are not quite there yet, so we do encourage that you please check PHLpreK online in your admin account at least 2 times a week to stay on top of the applications that come in. Next, returning children. This is a newbie. Returning children do not need to complete a new application. Again, returning children do not need to complete a new application. If their child attended during the FY25 school year, a new application is not needed. We ask that you simply re-enroll them. As noted here, it should be a hyperlink there. I'll fix that. If the child discharges during the school year and returns during the school year, again, a new application is not needed. We just strongly encourage that you make sure you update any contact information, and get the other documents that you need to enroll the child, but they do not have to complete a new application. Lastly, we have a new feature, school transfers. If the child is attending Ties Tots and wants to now enroll at PHLpreK, you can now complete a transfer request form for their family so that we can smoothly transition them to the new location. The family does not need to complete a new application. We will transfer their application and obtain all necessary documents to help support them in transitioning to their other location. The transfer request form is there for you to see, and if you have any questions, again, please do not hesitate to reach out to PHLpreK at phnc.org. I did
Thanks,
see a hand
Jen.
and I did see a question.
Okay, great.
So I do want to open it up for questions if anybody has any questions. So Christine, you said we can upload paper applications also. When doing enrollments for children, if they did a paper application, you always have to upload the paper application so that we can have that on file because we still need application, whether completed online or whether completed in that paper format. And it was a hand.
Hmm.
All right.
I'm sorry. I have one question. In the past, we had to, for the returning families, we had to get new proof of address. Do we have to do that this year?
You do not.
Continue to do that? No more?
You do not. So with the no new application, no re-verification of documents, sort of. We do still encourage you to make sure that birth date is correct.
Oh,
Obviously, the
yeah.
birthday can't change, right? If anything, it's the address, just making sure they remain in Philadelphia for a PHLpreK seat. And also, we ask that you update childware because there are times that we are sending out mailings to the family. So the address, we do encourage, strongly encourage, please help us out of updating the address in childware because for kindergarten registration, which we'll talk about in a second, we send out mailings to those families to let them know, hey, you're eligible. This is the link for you to register for kindergarten. So we do just ask that you make sure that address is correct in childware. And again, that you have the most recent documents on file, but they do not have to resubmit because you've already verified.
Okay. Now you said about sending out information on kindergarten registration through childware. We do not use childware because we're partners with the district and our
Mhm.
affiliate pre-Ks. We do COPA. Do you send them out to families in COPA as well?
We do. So, well,
All right.
yes and no.
Okay.
All children that enroll in PHL Pre-K, PHL Pre-K, we send it out. So all of our children that we know that are transitioning from PHL Pre-K and should be enrolling in kindergarten this coming September, we pull their addresses to mail that out. So if you are a school district site, they have already provided us with the address when they enter them in the system for us.
Okay.
So
Thank
you're
you.
covered. Yes, Lisa. Returning children do not need new proof of address uploaded in childware. You simply just go to their childware application, go to the application enrollment tab, select new application, and re-enroll the child, and then we will approve.
Okay, I don't
Thank
think we
you.
have any other questions. So thanks, Jen. And I just want to say, Lisa, I did see your direct message. So we can chat offline about what you shared. So thank you, though. Thank you. Okay, Q4
I
deliverables.
had a question.
Oh,
Sorry.
sure. Sorry, Latanta, go ahead.
It's okay. For the sites that got seats added this year, I got two letters, so I'm not sure what's going on. How will I know which seat allotment is going to the 25, 26? Am I waiting for a third letter? Because I got approval letter and then I think I saw another letter that said 2025, 2020 seats. Well, in my portal, it still has the old numbers. That's what it is. So in childware,
We'll double check the numbers, but a few that have got seat increase or decreases in the FY25 year, we aligned your FY26 allocation to that. Regardless, you should be getting another notice when
okay,
everything's final, but we will definitely check in on your childware allocations,
okay,
and
thank
adult
you.
free Philly pre-K allocations as well.
All right.
I have a question.
Sure.
Yeah, I was driving. I think I missed some of the information. Is this recorded? Can you have access to it? To the
Yes, we
slide?
yes, we always send the recording and the slides in Friday's Friday following the meetings provider update. So
Okay,
you'll
thank you
have
so
them
much.
this Friday. Yep, sure.
Thank you so much.
hmm And that will also include the PDPH slides as well.
Great.
All right. Let me just check the chat. Let's make sure that we did not. We do have a question that says if a parent, it says POADD is a form of picture ID and is expired, does this need to be updated? And
So the
it's
proof of
it says
address. Right.
right, okay.
So proof of
Uh,
address, if it is expired, technically it's already been verified. If the family shares that they've moved out of Philadelphia, then again, that's the drawing line because that's one of the requirements for PHL Pre-K. But if you're having a conversation with them and they're providing you with information, for sure you can ask them, hey, can we have an updated document for that? It helps them one to stay current and helps us to make sure that we have the most recent address for them.
all right. Thanks, Jen. Thanks. And I would not have guessed that was proof of address. So you can tell you work very closely. Yes, I did not think of that. All right. Okay, I think that's it for questions. All right, so we are going to move into the Q4 deliverables. So actually, Jen, I believe you're going to present on the kindergarten transition piece.
Yes, kindergarten transition. The kindergarten transition benchmark must be completed by June 2nd, 2025. We ask that you please enter all kindergarten registration notes into childware by this date. Additionally, you want to make sure that you record the school where the child is registered in the data system as well. So why is it important to document a registration note? This data is reported annually to OCS and it helps us to track the supports provided to children transitioning into kindergarten. There's also a required data entry in the FY25 contract deliverables for any child who is eligible for kindergarten. So again, we have about 2,700 children that will be transitioning into kindergarten. We have also supported by sending out some postcards to encourage them to apply as well. And again, redirect them right to you, their provider, if they have any questions of their process. Some tip sheets are here as well of how to add those transition notes and a video that you can watch if you need any support. Thank you.
All right, thanks, Jen. So another deliverable for Q4 is the spring checkpoint for Teaching Strategies Gold. The checkpoint is May 15th. So regarding the assessment, please make sure that each child is finalized in all areas at 100% by the checkpoint. Regarding documentation, each child must have at least one piece of documentation entered per area. And then also as a reminder, if a child enrolled on or before May 1st, they need to be included in the checkpoint. However, if a child enrolls May 1st on, that child does not need to be included in the checkpoint. Also, the PHMC data team will conduct assessment and documentation checks before the May 15th checkpoint. Based on the results of those checks, your specialist and coach may follow up with you. For example, May 1st, if there's an assessment check on May 1st and it shows that your program is still at 0% regarding finalization, then your specialist and coach will follow up with you to find out what are the barriers, what support do you need, and how we can help you move forward. The other deliverable for Q4 is family engagement monitoring. So family engagement monitoring will occur from April 1st through April 30th. Providers must demonstrate evidence of at least one family communication per child and a program-wide communication. Acceptable documents of evidence include TSG developmental reports, parent-teacher communication, daily reports, program-wide communication such as flyers, newsletters, and calendars, documentation of the kindergarten transition meeting, and also communication apps such as Tadpoles and Class Dojo. All right. Before we move on to system supports, I'm just going to see if there are any questions. It says if the child enrolled after May 1st, if not included in finalized checkpoint, it will not show 100% complete. Is that okay? So generally, my understanding was if you don't put the child in, then you know it's not going to affect your percentage, right? So if the child's not included at all, it should not show up in the data. However, if for some reason that happens, then yes, reach out to your specialist, and then we will make the adjustments on our end. Okay. So we'll move on to system supports. And I will turn it over to Jen to discuss the family corner.
Back again. Hello. Yes. So we have a new piece that goes into our newsletter. It is called the Family Corner. We found that providers are sending maybe like the kindergarten a transition landing page or enrollment landing page to families, but we wanted to create something that's just for the families, has everything the families need, and doesn't confuse them with anything provider related. So we have the family corner. We have like 5 issues that have gone out. Medea Pruitt, our family engagement coordinator, heads this to make sure that she's sending out updates. So each week, I'm sorry, every 2 weeks, you'll receive this link in your newsletter, which can go directly to the family. And if we go to the next slide, please. So The Family Corner starts off with a Did You Know? So it shares something new. So the first day of spring is Thursday, March 20th. That is today. Happy spring. We hope that spring is really here and that it's not the 52 fake out and winter is coming back, right? Um, we also share some fun winter activities or will be fun spring activities coming up to share different events that are going on in the city. There's some free activities listed here, some low cost activities here, and some that may have little cost, but we want to also encourage families to invest in experiences with their children. The next part are some resources. In this issue, it talks about how to find a primary care physician, so how to find a doctor. We also do a kindergarten transition piece, so it's sharing how students must be 5 on or before September 1st to start. We have a QR code that takes them right to registering for kindergarten. Um, and then we have our It's All About Peer. Sorry, that's not on the tab. But It's All About Peer is a support desk from Spark. And it's really about encouraging family child engagement, that parent engagement with their children. So they're pausing to take a moment to like really tune in and work on that relationship. They're engaging with their child. They're then encouraging their child and then reflecting. So trying to really encourage families to make every moment count because as we know, when they come out, they're so precious as a baby. Before you know it, they're 6. Before you know it, they're 13 going on 25. So we want to encourage families to really utilize that service. And we also redirect them back to Spark because there's some booklets that families can get to continue keeping that support going. So there's our family corner. Please do encourage you. I encourage you to share with your families. You can post it up. There's some hyperlinks, but again, there are also some QR codes where they can get connected right with a support to help them as they continue to do this thing of parenting.
Thanks, Jen. So yes, we are so excited about the Family Corner. So I hope providers will click on the link in the provider update and share with families. So thank you so much. All right, so I'm going to discuss a few NEAR updates. So NEAR observations will continue through the end of May. Data collectors generally arrive around 10 to 15 minutes before the start of the school day. Please keep in mind that data collectors cannot share individual results with teachers, directors, or anyone else at the time of the observation. However, Spark, particularly your Spark coach, will provide this information to you following the observations. Also, if there are any changes to staffing or the teacher schedule to be observed isn't present on the day of the observation, please email Charlie and Clarissa to let them know. I know that there are times when, a teacher may call out and then you're trying to figure out coverage, so you may not have time to email NEAR. But if there is time, it would truly be appreciated if you could email and let them know so that the data collector doesn't show up. We also want to share with you that PHLpreK and the PA Key are collaborating to offer virtual office hours. So PHLpreK providers can speak directly with the PHLpreK early childhood mental health consultants via the PA Key's virtual office hours on first and third Fridays. This is a great way to ask questions about children's behaviors, problem solve, and determine if child-specific behavioral supports are needed. You can also call the virtual office hours if you have families that are not consenting to ECMH consultation. You could call and ask some questions. You could problem solve about, how can you encourage the family to sign or to consent for early child mental health consultation. But it's a great way, just to kind of decide too if those supports are needed. We have a link here for the providers, and we also have a link for the families. So families can also call and access the virtual office hours. And now I will turn it over to our partners, Spark.
Assured Spark Quality Support Center is here to offer you quality supports as you meet your PHL pre-K deliverables. Next slide. These are the many ways that you can access our support. You might have seen this before: live trainings, lunch and learns, community of practice, of course, coaching, and many topics on on-demand trainings. Next slide, please. And these offerings support these learning pathways, curriculum and instruction, supporting children and families, and business leadership practices. Next slide. Next slide. All right. Specifically for quarter 4, as I go through these links, one of my colleagues will drop them into the chat so you can have access to them. Specifically for Teaching Strategies Gold, there is a note template that will be dropped in the chat for those that may need it to organize any notes that you may be taking. Also, if you are using the app, the Teaching Strategies Teacher app, which is available on your Apple or Android, here is a link that will show you very easily how to add documentation on the app. The next link is just the standard way of adding documentation. There is a quick video here that will walk you through adding documentation on your laptop or desktop. The last support for teaching strategies is the pacing guide. The pacing guide will keep you on track with uploading your documentation. The pacing guide is a real great tool to use. If you do use it, you will find that when the due date is approaching and when it is due, all you would need to do is finalize and submit your documentation. In reference to the kindergarten transition, if you're looking to revamp or spruce up your kindergarten transition plan, here is a kindergarten transition toolkit with many ideas that could help you to do that. Also, there is a link for supporting learners at home. There is a tip sheet here for activities that families can do at home while they are supporting their children. And lastly, there is a link to the School District of Philadelphia's Family Activity Hub. There are many, many, many activities on the Activity Hub that can be accessed for families. Next slide. And if you don't already know, if you have any questions or concerns, this is a way that you can reach out to us. You can connect with us on our website. You will see the events calendar, our knowledge center. And then, of course, you can contact us by calling us or sending an email to the help desk. Nicole is there. She will answer your questions. And then if not, she will get you to the appropriate person to do so. All right. Thank you very much. Back to you.
Thank you so much, Dina. So the final part of our meeting today, we just want to update you on some upcoming engagement activities that OCF will be supporting. So OCF wants you to know that they want to celebrate our youngest learners by showcasing the PHLpreK program. Okay. I'm just going to keep clicking till we have everything on the screen. Okay. So some of the ways that, OCF wants to partner with you to celebrate those special moments is through the Week of the Young Child. So we are encouraging you to tell us about your planned activities for this special celebration. We love to attend and document these meaningful moments. For those who have site visits and coaching visits scheduled this week, you know that we have been taking pictures in your programs. Those photos will be shared with OCF and will be used to tag different days during Week of the Young Child. Also, for move-up celebrations, you can share details about your end-of-year ceremonies. The PHL Pre-K system wants to really partner with you, right, to celebrate the recognition of the children moving on to kindergarten. And then for site-specific events, if you have any unique projects or occasions coming up, any special initiatives, please let us know. So your Spark coach or the provider engagement coordinator with OCF, Brittany Eady, will reach out soon to gather information about these events. And then this slide just shows that the contact information again for OCF to actually share this information with them is Brittany Eady, and Brittany's email address is brittany.eady@phila.gov. So please share any updates that you have. If you have photos that we didn't take this week, or you just want to highlight a special event in your program, please email Brittany. Also, for their social media feature, if you want to be featured on the city's social platforms, again, share your photos and videos. You can send them to Brittany. And then regarding the citywide play date, we are excited that that's happening again this year. It will be on May 3rd at Smith Playground. Please have your families mark their calendars, and I'm sure there's more information to follow. Before we get to dates to remember, I'm just going to check and see if there are questions. It says, where are we sending the proof of family engagement? So when your specialist monitors for this deliverable, they will collect the evidence at that point. Okay. We have- Just looking. So Spark has put a lot of links in the chat. So please make sure that you see those links. All right, I think that's it for questions. So our dates to remember. April 7th through the 11th is Week of the Young Child. Again, May 3rd is the Citywide Play Day. May 15th is the TSG Checkpoint. May 30th is the estimated date for the public pre-K teacher incentive payments. May 30th is the date that you need to discharge all currently enrolled FY25 children with a future discharge date. And June 2nd is the kindergarten transition benchmark. And if there are no other questions, again, we are so glad that you were able to join us today. Again, these slides and the recording will be in the provider update on Friday. Wishing everyone a wonderful rest of the day. Thank you.